To care for a responsive adult who is choking, first call for additional resources and obtain the patient's consent. Are you choking? Can you speak? Call for the rapid response team. My name is Chris. I'm a nurse. May I help you? Ava is going to help me demonstrate how to perform abdominal thrusts. First, stand behind the patient with one foot in front of the other for balance and stability. If possible, place your front foot in between the patient's feet like this. Then get your hands in place. Using one or two fingers to find the patient's navel, make a fist with your other hand and place the thumb side of your fist against the middle of the abdomen just above the navel. Grab your fist with your other hand. Now give quick inward and upward thrusts. Be sure to make each thrust a distinct attempt to dislodge the object. Continue giving abdominal thrusts until the object is forced out, the patient begins to cough forcefully, speak or breathe, or the patient becomes unresponsive. Evidence suggests that it may take more than one technique to relieve an airway obstruction in a responsive adult who is choking. For example, you might not be able to reach far enough around the patient, or they might be pregnant, in a bed, or in a wheelchair with features that make abdominal thrust difficult to do. Or abdominal thrust just might not be effective in dislodging the object. When that happens, use back blows, chest thrusts, or other airway management techniques to dislodge the object from the airway. And remember, follow your facility protocol when implementing alternate techniques. To provide back blows, position yourself to the side and slightly behind the patient. Provide support by placing one arm diagonally across the patient's chest. Then bend the patient forward at the waist so that the upper body is parallel to the ground or as close as it can be. Using the heel of your other hand, give 5 firm back blows between the patient's scapula. Make each blow a separate and distinct attempt to dislodge the object, like this. If that doesn't dislodge the object, use a series of 5 back blows and 5 abdominal or chest thrusts. Here's what it would look like. To perform chest thrusts, position yourself behind the patient as you would for abdominal thrusts. If the patient is in a wheelchair, like Will here, you may need to kneel. Place the thumb side of your fist against the center of the patient's chest on the lower half of the sternum. Then cover your fist with your other hand and pull straight back, providing a quick inward thrust into the patient's chest. If you are in a healthcare facility and abdominal thrusts, back blows, or chest thrusts are not effective or practical, use a combination of basic or advanced airway management techniques based on your level of training and experience.
The technique for clearing an obstructed airway of a child is similar to that of an adult, with slight modifications. As always, when caring for a child, be sure to obtain consent from a parent or guardian before providing care. Of course, if they are not available, consent is implied. Jane is going to help me demonstrate this skill. You might want to kneel behind the child to provide effective abdominal thrusts, back blows, and/or chest thrusts. Here's what abdominal thrusts for a child looks like. 1, 2, 3, 4, 5. If necessary, I can attempt back blows. 1, 2, 3, 4,